Welcome back. In the previous segment, we had talked about the determination and disclosure of borderline personality disorder. In this segment, we're going to talk about treatment of borderline personality disorder, or BPD. One of the things we've noted at the McGill University Health Center is that patients with personality disorders often don't fit particularly well in the current clinical system. In part, this is because psychiatry is becoming increasingly specialized by diagnosis, and although there may be specialized programs for the treatment of schizophrenia, mood disorders, or anxiety disorders, often these programs don't exist for individuals suffering from personality disorders. As a result, patients with borderline personality disorder are largely by default treated within the context of general psychiatry clinics, and unfortunately, these are frequently short on resources. Because of these factors, treatment is largely focused on containment or holding rather than working towards clinical improvement. Because of our training, we often use the medical model, and this focuses primarily on pharmacotherapy. Unfortunately, medications have a severely limited role in terms of their usefulness in the treatment of borderline personality disorder. Administrators are often frustrated as well because they note that the most severe cases of borderline personality disorder tend to use a disproportionate amount of other resources within the healthcare system, particularly emergency room visits and inpatient hospital bed days. As a result of these factors and others, many clinicians and treating teams, as well as patients and their families, are frustrated by the current system. In 2004, we received the mandate to develop a specialized treatment program to help deal with these complex cases of borderline personality disorder at the McGill University Health Center. It was hoped that not only would this type of treatment program reduce the suffering and increase the quality of life of these individuals, but hopefully also reduce the burden of emergency room visits as well as hospitalization rates. Let's take this opportunity to look at a clinical vignette of one patient that was treated within the context of our program.